Hi, this is Dr. Byrne with High Point Spine and Joint Center. I wanted to make a quick video recapping your diagnosis of cervicogenic vertigo, as well as letting you know some of the treatment options we have to treat your condition in the clinic and some things that you can do at home that may help. So cervicogenic vertigo is a disease process that's usually characterized by a feeling of lightheadedness. Some patients will say they feel like they're floating or they're kind of off balance or unsteady. It rarely involves true spinning like we see in different types of vertigo, but it gives you more of the floating, unsteady. Some people say, I just feel off. And that can be characteristic of cervicogenic vertigo. Many patients report some sort of neck discomfort. Sometimes even may notice a small headache that seems to be stemming from their neck or from the base of their skull. One thing just about cervicogenic vertigo, there's three different really systems that are input into our brain that help us to establish our sense of balance. There's really your inner ears, your eyes help with it. And then the one that really concerns us the most with cervicogenic vertigo is there's these little pressure sensors in your neck, especially in the upper neck. And the dizziness or the vertigo arises when one of these balance system malfunctions, and it kind of confuses your brain about where your body is in space. And it leads to this dizziness or this unsteady feeling. So for example, if I was going to tip my head to the left, these pressure sensors in the left side of my neck tell my brain, hey, we're going left. And that's where we are oriented in space. And if the inner ear and the eyes agree, then all is well. But if you have a sensory mismatch there, you'll have that feeling of dizziness, unsteadiness, floating, things like that, that is characteristic of this cervicogenic vertigo. The nice thing about it is that what we can do in the office can help a lot, because conservative care like chiropractic can help to use joint manipulation or adjusting in the spine to make sure that the joints of the neck are in their right biomechanical position, functioning correctly, to make sure that those pressure sensors, we call them proprioceptive receptors, are not functioning abnormally, but that they're functioning correctly. And that can help us in treating this cervicogenic vertigo to make sure that system is working correctly. We also use some different therapeutic modalities to help with muscle stiffness, muscle tightness in the neck, things like dry needling, myofascial release, those types of things. Things that you can do at home. I think one of the biggest things is just trying to make sure that you do some of your home exercises that we give you in the office that can help to release tight muscles, release muscle tension, and help those muscles of the upper cervical spine that create some of this cervicogenic vertigo. It helps them to function better. And so if you can keep up with your exercises, that is one thing that you can do to really help with some of this cervicogenic vertigo. So if you have any questions, please call our office. We're happy to answer any questions. You can also text the office. And thank you for listening, and we'll see you at your next appointment. Thanks.